Some people also experience sudden numbness or weakness, especially on one side of the body. This can affect the face, arm or leg, and typically occurs on just one side. Risk factors you need to know. Understanding your risk factors is crucial for prevention. Some risk factors you can't control, but many you can. Age is a significant factor. The risk of stroke increases with age, particularly after 55. However, strokes can happen at any age, and we're actually seeing more strokes in younger people than ever before. Family history and genetics play a role. If stroke runs in your family, you may be at higher risk. Gender also matters. Men have a higher risk of stroke at younger ages, but women have a higher lifetime risk and tend to have more severe strokes. Race and ethnicity are factors too. African Americans, Hispanics, and certain other ethnic groups have a higher risk of stroke. Now let's talk about the risk factors you can control, and this is where you have real power. High blood pressure is the single most important risk factor for stroke. If you have high blood pressure, work with your doctor to manage it. Smoking dramatically increases your risk. If you smoke, quitting is one of the best things you can do for your brain and overall health. Diabetes increases stroke risk, especially if blood sugar isn't well controlled. High cholesterol contributes to artery blockages that can lead to stroke. Obesity and lack of physical activity both increase your risk significantly. Heavy alcohol use and drug use, particularly cocaine and amphetamines, can trigger strokes. Atrial fibrillation and other heart conditions can cause blood clots that travel to the brain. Transient ischemic attacks, the warning stroke. Let me tell you about something called a TIA, or transient ischemic attack. This is sometimes called a mini stroke or warning stroke, and if you experience one, you need to take it very seriously. A TIA produces stroke-like symptoms, but the symptoms usually last only a few minutes and cause no permanent damage. The blood flow to part of the brain is briefly blocked, but then it resolves. Here's the critical part. Having a TIA puts you at much higher risk for a major stroke in the near future. About 1 in 3 people who have a TIA will eventually have a stroke, and about half of those strokes occur within a year of the TIA. Even if you feel fine after a few minutes, call emergency services. A TIA is your brain's way of sending up a flare saying, "We have a problem here that needs to be addressed." Getting evaluated after a TIA gives doctors a chance to find the cause and take steps to prevent a full stroke. This is your warning and your opportunity to prevent something much worse. What to do in a stroke emergency. Let's go through exactly what you should do if you think someone is having a stroke, because your actions could save their life or reduce disability. First, call emergency services immediately. In most places, that's 911. Do this right away. Don't wait to see if symptoms improve. Note the time when symptoms first appeared. This information is crucial because certain treatments can only be given within specific time windows. While waiting for paramedics, keep the person comfortable. Have them lie down on their side with their head slightly elevated in case they vomit. Do not give them anything to eat or drink. A stroke can impair the ability to swallow and they could choke. Don't give them any medication, including aspirin, unless told to do so by emergency medical personnel.